2020 to 2021, a year in view. A year like no other in Warrington's history. NHS Warrington Clinical Commissioning Group is your local NHS commissioning organisation responsible for getting the best outcomes for the 220,000 people who live in our town. The majority of services that we commission are provided by Warrington and Halton Teaching Hospitals NHS Foundation Trust, Merseycare NHS Foundation Trust, and Bridgewater Community Healthcare NHS Foundation Trust, and some specialist services provided from further afield. Like other clinical commissioning groups across England, we set out at the start of 2020 with a clear plan for improving the health of our population, guided by our strategic objectives, our vision, and our values. Who knew that we'd be faced with the huge challenge of a global pandemic when the first cases of COVID-19 reached the UK in January 2020? The CCG acted swiftly and established its Incident Control Centre to support the system in responding to the pandemic, and started to work differently with a focus on keeping people safe and well and saving lives. Within weeks, our GPs were receiving hundreds of calls a day from worried people. So in just 3 days, we rapidly set up the Warrington and Halton COVID Patient Advice Line and deployed a team of 12 staff. In the first few weeks of operation and at the height of the pandemic, it managed over 1,458 enquiries from patients. Since the start of the pandemic, our town has had 27,430 lab-confirmed cases. That's 13% of our population. During the pandemic, everyone pulled together in lots of different ways to help to control the spread of the virus, with our providers, partners, primary care networks, community and voluntary sector colleagues working together with one simple aim: protect and support the people of Warrington. Protecting the elderly and those at higher risk was paramount, and we worked with our local authority partners and care homes to keep those in care homes safe, providing training, equipment, and specialist infection control advice. Quality and patient safety at the centre of everything we do. Warrington was at the forefront of the vaccination rollout beginning on 16th of December 2020. And thanks to the efforts of our primary care networks, doctors, nurses, and the many volunteers, our vaccination centres ran day and night, weekdays and weekends, so that people in Warrington could receive their vaccinations. And we made history when 98-year-old former GP, Dr. Philip Leach, became the first person in Warrington to receive the coronavirus COVID-19 vaccination. Since then, over 150,500 people over 18 years old have had their first vaccination across Warrington. That's 91% of our population. And over 139,500 people over 18 years old have had their second dose, which is 84% of our population, thanks to the heroic efforts of those who work in and with the NHS. During all of this time, the CCG has focused on supporting and improving the health and well-being of our communities, and to achieve the best possible health outcomes for the people of Warrington. And now that the restrictions start to lift and things move to a new normal, and whilst we are still fighting the COVID-19 battle, we are also looking to the future, to deliver our key priorities and also transition to the new world with a reset and recovery plan that protects the most vulnerable from COVID-19, restores all NHS services, optimises digital access across key pathways, promotes prevention, including improving uptake of flu vaccinations, collaborates across the whole system. As we reset and recover, we also have a focus on the future, and will continue to work with our partners and providers across the Cheshire and Merseyside Integrated Care System, ICS, in readiness of the transition by April 2022. Locally, we are making excellent progress in the development of our Integrated Care Partnership, our place, Warrington Together. Warrington Together sees our health and social care services working together with local people to create a healthier, happier Warrington. We will continue to build on our strong foundations to make better use of precious resources. Local people will play a key role in shaping the delivery of health and social care services, And what we do in the future depends on what we learn from listening carefully to local people, service users, and our staff. When the world stayed apart, we all pulled together. We are proud of the way that everyone across the town has come together. Over the year, there have been so many stories of remarkable self-sacrifice by so many amazing people in the most difficult year that the NHS has had to face in its entire history. And to every person across Warrington that has helped in any way at all during this year, we want to say thank you.